Hello, everyone, and welcome to Heads Up, the weekly webcast and podcast of the National Headache Foundation. I'm Dr. Lindsay Weitzel, migraine strategist, founder of the Facebook group Migraine Nation, and chronic daily migraine survivor. I am here today with Dr. Vincent Martin. Dr. Martin is the director of the Headache and Facial Pain Center at the University of Cincinnati, and he is also the president of the National Headache Foundation. Hi, Dr. Martin. How are you doing today?
Great. How are you?
I am great. Thank you so much for being here. We have an awesome topic that we have not covered before that I think is pertinent to everyone to listen to, and everyone's going to want to hear. Today, we are going to talk about tension type headache, what it is, what it isn't, how we know if we have it, and what to do about it. This is the most common primary headache disorder that we have. Also, it's very easy for people who have never experienced migraine to just assume that migraine is another form of tension headache. So we want to clarify exactly what the difference is between tension headache and some of the other primary headache disorders. So let's start out with Dr. Martin. How common is tension type headache?
Well, as you said before, tension type headache is the most common form of headache known to man. In fact, one study suggested that about 33 to 35% of all Americans had had a tension type headache at some point during the previous year. So it's probably about 2 times or maybe 2.5 times more common than migraine.
Okay. So what exactly is the definition of a tension or tension type headache?
I'll just kind of give you a description because the definition might get a little bit too technical for the audience, but a tension type headache is generally a band-like headache. They usually describe it as a hat band going across the head, tends to be of mild to moderate intensity. Okay. And generally speaking, it lacks what we call the associated symptoms of migraine. Associated symptoms of migraine are sensitivity to light, sensitivity to noise, nausea, and vomiting. They do, with episodic tension type headache, allow either sensitivity to light or sensitivity to noise with the headaches to it still meets criteria for tension type headache, but it's generally like the exact opposite of migraine. So migraine tends to be more moderate to severe. This tends to be more mild to moderate. Okay. Migraine tends to generally be one-sided. This tends to be two-sided. And this tends to also migraine is worse with exertion and tension type headache is not. So it's like the exact opposite to the criteria for migraine.
Okay. Also, the word tension makes it sound like it's caused by stress. Is this true about this type of headache? Does stress make it worse or bring it on?
Well, tension type headache is a misnomer because when you think about tension type headache, it kind of alludes to what you just mentioned, namely that the tension or stress is actually causing the headaches. And that's really not true because tension and or stress can trigger almost any type of pain or any type of headache. So it can trigger migraines, it can trigger tension type headaches, and it can trigger cluster headaches, as well as other headache disorders as well. So the other thing that is often implied by the name tension headaches is the thought that maybe the muscles of the scalp and forehead are just contracting, and that's causing tension on people's heads. And they've disproven that as well. So the cause of tension type headache is thought to be some sort of lack of control of pain within the brain that allows tension type headaches to be perceived.
Oh, okay. So that is a super interesting fact that I bet a lot of us did not know. I think that most of us think that it really is the muscles in our head or our face that are causing this problem. So are there other headache disorders that sort of mimic tension type headache that we could easily confuse for this particular type of headache?
Well, there's lots of types of headache disorders that could theoretically have headaches that resemble tension type headache. In fact, if you've got a history, well, let's just go to migraine as kind of an example. If you got a history of migraine, then anything superimposed upon that will resemble migraine. So if you've got disease of your TMJ joint, or you got some allergic triggers, or if you've got some neck disease, then a lot of times that will resemble migraine. Now, if you take the converse of that with tension type headache, so let's say you don't have the migraine predisposition, then basically any other disorder could theoretically have headaches that meet tension type headache criteria. And the common ones would be maybe you've got some low-grade sinus disease, no predisposition to migraine. So you have tension type headaches that are in the forehead, between the eyes, and in the maxillary sinuses or cheekbones.
Right.
Or if you've got TMJ, then maybe that causes headaches that are one-sided in the temples that might meet tension type headaches. Or if you've got spine disease that refers back up into the back of the head, then that may resemble tension type headache too. So the key thing is to realize is the tension type headache could theoretically have many different triggers and presentations of other diseases.
Interesting. Okay. So my next question is, sort of like we end up getting chronic migraine. Can someone end up with a pattern of chronic or daily tension headache?
Absolutely. There is something called chronic tension type headache where patients have 15 or more days per month with tension type headaches. And that is a situation where the central nervous system becomes sensitized, just like in migraine, particularly chronic migraine, where the nervous system gets sensitized. The same thing can happen with tension type headache, which makes the headaches more frequent and more susceptible to triggers.
Okay. Can someone have migraine and tension headache at the same time?
Yes. The bottom line is that if you've got migraine and tension type headache that coexist in the same patient, many headache doctors, particularly within the United States, think that the migraine and tension type headaches are just spectrum of migraine.
Okay.
And they've even shown in studies that if you've got tension type headache and you have a history of migraines, that you may respond to migraine-like medications like the triptans, like sumatriptan or Imitrex, and so forth. So if you've got tension type headache and migraine, the tension type headaches may even respond to migraine therapies. Now, if you've got tension type headache by itself, then that may not respond to migraine therapy. So they're probably different animals. So if you've got just tension type headache by itself, that's much different than if it coexists with migraine.
Can the tension headaches make the migraines worse and vice versa if you're one of these patients that has both of them?
Well, once again, if you think that migraine and tension type headaches are kind of a spectrum of the same disease process, then absolutely. It's kind of like the more headaches you have, the more headaches you have. And then all the headaches sensitize the nervous system to just respond to everything. So like I had, for an example, when I had chronic migraines when I was younger, and when I had those, every trigger would trigger a headache. I mean, every time I didn't eat on time, and anytime I made a dietary mistake, anytime I had just one sip of a beer or something, boom, I would have a headache. And the same thing is true with tension type headache.
Okay. So how is tension headache treated?
Well, there are not a lot of great studies for tension type headache. And the reason is that most patients are treating these with over-the-counter medications. So they'll treat them with anti-inflammatories, maybe aspirin, Tylenol, and caffeine combination pills. So they're using over-the-counter medications to treat them.
Right.
In terms of prevention, there have been several different studies and drugs that have been looked at. One is amitriptyline, which is a small dose of an antidepressant, and that's usually given at night. The main side effects are going to be dry mouth and a little bit of sleepiness, but if it's taken at night, who cares? The other ones have been some of the other antidepressants too. There's another one called mirtazapine. The trade name for that is Remeron, and another one called venlafaxine. Trade name for that is Effexor. So those are the three drugs that have probably been best studied. Okay, there are some studies to suggest that tizanidine, which is a muscle relaxer, has been used as well. So those are all more preventative type therapies. And there was one study in children where they found that if you combine amitriptyline with biofeedback or relaxation techniques, more behavioral therapies, that the combination worked better than just amitriptyline by itself. So there may be some role for behavioral therapies as well in the treatment of tension type headaches.
Okay. Something that we didn't really cover what are the epidemiological characteristics of tension headache? Is there an age range that's more likely to get this type of headache? Men, women?
Well, women are more common, are more likely to get almost any headache disorder, including tension type headaches. But Once again, tension type headaches run in that 20 to 50 age range for the most part. There's also some thought, however, that if you've got migraines earlier in life, that you can lose some of what we call the associated symptoms, like we talked about before of migraine, things like sensitivity to light, noise, nausea, vomiting, and the headaches that used to resemble migraines earlier in life. Sometimes as you get older, they have more tension type headache characteristics.
Interesting. Okay, that is an important thing to know. Is there anything else you would like to add to our discussion of tension and tension type headache today?
No, I would just say a few things. One is, as we said before, it's the most common headache disorder out there. It's one that can be, in some cases, disabling. So just because you have mild to moderate headaches most of the time, it doesn't mean that you couldn't have a tension type headache that on occasion might be severe. So there are times where it might impact your life. I think there are therapies for this, mostly antidepressants and muscle relaxers that can sometimes be used. And so there is hope for people that do suffer from tension type headaches.
All right. Well, thank you so much for joining us today, Dr. Martin. And thank you everyone for listening. Please join us again for our next episode of Heads Up, the weekly webcast and podcast of the National Headache Foundation.